Hello and welcome to PCOM Perspectives. I'm your host, Dr. Jay Feldstein, and today we're talking with Dr. Stephanie Felgoise, Professor and Vice Chair of Psychology, about PCOM's efforts to encourage interprofessional education across the college. Interprofessional education, or IPE, provides a unique educational experience for students from across academic programs to learn with and from each other. The goal is to train our students to think of healthcare as a team sport, with each area contributing its own skill set to achieve the best outcome for the patient. Dr. Felgoise has been instrumental in this initiative at PCOM. Welcome, Dr. Felgoise.
Thank you very much, Dr. Feldstein.
Can you give our listeners a brief overview of PCOM's IPE efforts?
Sure. Well, true to the osteopathic tradition, our practitioners across programs have always been trained in a holistic approach to patient care. And for about more than 15 years, our medical and clinical psychology students have worked together to take care of our patients in our healthcare centers. Patients are more than their disease or their illness, and PCOM faculty and students recognize and respond to this. So an interprofessional approach is really ideal. We're now in our third year of formally delivering IPE curriculum to most all of our students across programs, and they're learning from, with, and about each other, which has been really exciting because otherwise they may not interact on the campus. And they're coming together on topics such as diversity, elder care, substance use and impairment, care of people with physical and intellectual disabilities, business of healthcare. So with large group didactics, small group activities, they really get an opportunity to interact and learn about what each profession does, which will help our patients in the long run. And this year, we're really excited because we've added standardized patient experiences. So they're actually going to our standardized patient lab and working with the patient as a team. So it's been exciting.
How are these programs ensuring that our students will be as competitive as possible when they enter their healthcare workforce?
That's a great question. I think learning in silos doesn't give them the opportunity to practice the way they will when they're ultimately independent practitioners. So when they learn together, they're being exposed to critical aspects of patient care that requires knowledge, skills, attitudes dependent on collaborative thinking and practice. And so our students across the programs learn the strengths, but also the limits of their profession and what other healthcare providers can do that will facilitate the optimal care. So they become competitive in the workforce because they have this experience and understanding of holistic healthcare and how to implement it. And a lot of leading medical centers now are just trying to figure out how to do this and how to make it work. And our students will be ready to help them figure that out.
And how are we measuring the success of these programs?
Well, everything that we do at PCOM is outcome-based, as you well know, and in psychology we like to measure everything that happens here to make sure our programs are functioning optimally. So we are measuring the success in critical domains of learning, knowledge, skills, and attitudes, and our students complete readiness assessments before their IPE experiences. They're examined on content knowledge pre and post each of the sessions that they have. We survey their attitudes and satisfaction about each session, and we actually also have our faculty evaluate their interprofessional core competency skills based on our standardized patients and objective experiences. So we're looking at how their understanding is improving in provider-patient relationships, roles and functions of the other professions they've encountered. We're pretty much measuring everything that we say, think, and do in those classes.
So, and what have you found so far in terms of student satisfaction and competency?
So it's been a learning process, and I think by and large all the way through that the satisfaction ratings have been generally high. We really use feedback from students to improve the program from session to session, but overall the students have really loved learning about the other professions on campus and how they're going to work together in the future. So it's been really exciting for all of us, I think the students included. So Dr. Feldstein, as a former practicing physician, how have you seen the healthcare field change?
Well, it's definitely gone to a more team-based approach. And we have a lot of advanced practitioners, whether they be physician's assistant, nurse practitioners, a lot of behavioral health specialists in doctors' offices, especially in primary care, where things that we need to do to change patients' behavior, and also behavioral health issues are being treated in the primary care physician's office, not being referred out, not being lost to follow-up. So I think that's one of the most significant changes in healthcare, and you're going to continue to see more and more of that because I think it's associated with a better health outcome. And if we ever really want to address chronic disease, the goal to that is behavior change from a prevention standpoint. Traditionally, behavior health and physical health are carved out. They're paid independently. And I think you're going to see eventually a merging of that where it's bundled.
So it sounds like it's an advantage to the business and healthcare, to the practitioners, and of course, most of all, to the patients.
Agreed.
Okay. What do you see coming down the pike in terms of more team-based approach to care?
I think you'll see it from what we've just really talked about is everything in healthcare is who gets paid for what.
Right.
And I think we'll get to the point where you'll start to see practices being paid for team-based care.
And our students will be ready to be a part of that
for
sure. Why is interprofessional education an area that you're passionate about?
Because I believe that ultimately the best patient outcome comes from an integrated approach to care. So that everybody has the same information, everybody's familiar with the patient, everybody's addressing all the patient's needs from a holistic osteopathic approach, not just their little isolated area, with a captain of the team, and then everybody does their part. I mean, from a physician visit standpoint, seeing a physician 7 to 15 minutes, 3 to 4 times a year is not the answer. But having a team-based approach for people to fill in between those visits with their area of expertise, whether it be health coaching, behavioral health, addressing anxiety, depression, whatever, ultimately is how we get better health care outcomes.
I fully agree. I think it's really exciting.
Well, I know that you and your staff and faculty is doing a great job, but the way we're doing interprofessional education now, it's kind of after the standard curriculum. It's in off hours, it starts at 5 o'clock or it's on a weekend. Mm-hmm. I want us to get to the point where our students are sitting in the same classes. So they're hearing the same information together, the discussions are together, so it doesn't have to be an add-on, but it is part of the integrated curriculum.
That would be great. Do you foresee any barriers or downsides to training students in this manner?
I think a lot of it just has to do with the time, because each program, based on its accreditation standards, has to deliver set hours of set classes. Mm-hmm. And some of our accreditors are very strict as to who can deliver that information. Right. And I think if we can get past that, so it's really the information itself, not who's delivering it, we can have more students in more common classes. Thank you, Dr. Felgoise. Training our students from across disciplines to work together will better prepare them to work as a patient-centered team, capable of giving the best possible care. To listen to past episodes of this podcast and become a subscriber, visit our SoundCloud page or find us on iTunes by searching Philadelphia College of Osteopathic Medicine. I'm Jay Feldstein, and this has been PCOM Perspectives.